Hi everyone. Today in this video we are going to discuss about chlorthalidone. What is this chlorthalidone? The suffix of this drug indicates this drug is a thiazide-like diuretic. We know few of the thiazide drugs like chlorthalidone, hydrochlorothiazide, bendroflumethiazide. All these are ending with the suffix thiazide, so they are called as thiazide diuretics. But chlorthalidone is having the different suffix, so it is a thiazide-like diuretic. What is the relation between this chlorthalidone and the thiazide diuretics? Why this chlorthalidone is called as thiazide-like diuretic? This is because chlorthalidone is not having the structural similarity with the thiazide diuretics, but pharmacologically chlorthalidone is similar with the thiazide diuretics. That means structurally it is somewhat different, but by the mechanism of action it is somewhat similar. So today in this video let us discuss how this chlorthalidone acts, what are the side effects, precautions and indications. First of all, let us see the structure of chlorthalidone. So this is the structure of chlorthalidone. Here we can observe that it is not having the thiazide-like ring system. Thiazides are having benzothiazide ring system. That means the benzene ring is attached with the another 6-member ring system with 2 nitrogens and 1 sulfur. But such ring system is not present in the chlorthalidone. Chlorthalidone is having the isoindole ring system. And here the principal functional group is the sulfonamide. This sulfonamide is attached to the benzene. So we can write the suffix of the name as benzene sulfonamide. Then we can start the numbering from the principal functional group. So this is 1, 2, 3, 4, 5. So at the 5th position, isoindole ring system is attached. So second position chlorine group is there in the phenyl ring. So 2 chloro. And now this isoindole ring system is attached at the 5th position. So we can write this as 5' isoindole 1-ire. Because this isoindole ring system is attached by 1st position. And then we can fill the gap. This isoindole ring system is having the OH group at the 1st position. So 1 hydroxy. And keto group at the 3rd position. So 3 oxo. And it is saturated at the 2nd position. So 2H. So that is the complete name of chlorthalidone. So chlorthalidone is a isoindole derivative which is not having the thiazide ring system. Even chemically it is different, but still it acts similar to the thiazide diuretics. So now let us see how this chlorthalidone acts. So this is the distal tubule and this is the outer membrane which is called as basolateral membrane. This inner membrane is called as apical membrane. Now within the lumen, filtrate contains so many types of electrolytes. One of the important electrolytes is the sodium and another important electrolyte is the chlorine. Now the sodium and chlorine are going to be reabsorbed at the distal tubule, but they are not passively absorbed. In order to bring the absorption of sodium as well as chloride ions, specialized pumps are present on the apical membrane. So at the distal tubule, one of the pump is the sodium chloride exchange pump. This is also called as symport, because both of the ions are going to move in the same direction without any change in the membrane potential. So here, when the sodium is going inside, one chloride ion is also going inside into the tubular membrane, so that the net change in the membrane potential is 0. In this way, both of the ions are going to move in a same direction, so it is called as symport. But now the sodium which is present in the tubular membrane should be transported into the systemic circulation. So this can be achieved by another pump at the basolateral membrane, that is the sodium-potassium ATPase pump. This pump utilizes the energy, so that's why it is having the suffix ATPase, and it transports the sodium ions for the exchange of potassium ions. Sodium ions are going into the systemic circulation, and at the same time potassium ions are going to be transported into the tubular membrane. In this way, sodium is going to be exchanged for the potassium by sodium-potassium ATPase pump. Now we have seen that by these two pumps, sodium is reabsorbed into the systemic circulation. Then what about the chloride ions? Again, the chloride ions can be transported into the systemic circulation through the potassium ions. So potassium which is present in the tubular membrane can be exchanged for the chloride ions. So for this exchange, another pump is present, that is the potassium chloride exchange pump. So this pump again facilitates the transport of potassium as well as chloride ions to the same direction into the systemic circulation. In this way, sodium and chloride ions are reabsorbed into the systemic circulation and potassium is just recycled. Now let us see what is the action of chlorthalidone. So chlorthalidone is going to inhibit the sodium chloride exchange pump. thereby it inhibits the reabsorption of sodium and chloride ions. And when these ions are not reabsorbed, they are going to be excreted through the urinary filtrate. In this way, chlorthalidone can increase the excretion of electrolytes like the sodium, chloride, potassium and magnesium. What are the side effects? Side effects of chlorthalidone are because of its mechanism of action. Because it is going to block the sodium chloride exchange pump, it can inhibit the reabsorption of so many types of electrolytes. This chlorthalidone can inhibit the sodium reabsorption, which results in the increased sodium excretion resulting in the hyponatremia. Similarly, it can inhibit the potassium reabsorption resulting in hypokalemia, and it can inhibit the magnesium reabsorption producing hypomagnesemia, and it can inhibit the chloride reabsorption resulting in the hypochloremia. And apart from these electrolytes, it can also inhibit the proton reabsorption such that the acidic levels within the systemic circulation are going to be reduced, which results in the metabolic alkalosis. In this way, chlorthalidone can inhibit the reabsorption of so many types of electrolytes resulting in the hypo conditions. But at the same time, it can also increase the other electrolytes and other components and other metabolic products. For example, it can increase the serum calcium levels, which results in the hypercalcemia. Here we can clearly observe that chlorthalidone is going to inhibit the reabsorption of so many types of ions except the calcium, because the reabsorption of calcium at the distal tubule is going to be controlled by parathyroid hormone. That's why even the chlorthalidone is used, it cannot affect the reabsorption of calcium, so serum calcium levels are increased. Similarly, chlorthalidone can also increase the uric acid levels, which may result in the hyperuricemia, and it can also increase the cholesterol levels as well as triglyceride levels. Apart from these electrolyte and metabolic changes, it can also produce few of the other side effects. One of the important side effects is hypotension, which is because of the hyponatremia produced by chlorthalidone. Similarly, it can also produce headache, dizziness, and even it can produce diarrhea or constipation. And another important side effect is the hypersensitive reactions. Because this drug is having the sulfamide moiety, so it can produce few of the hypersensitive reactions, which may result in the few of the skin rashes as well as purpurea and pruritus. So these hypersensitive reactions can be observed with the chlorthalidone because of sulfamide moiety in the structure. What are the precautions? One of the important precautions of chlorthalidone is that this drug is going to produce the hypotension. This hypotension is a symptomatic hypotension which can be controlled, and chlorthalidone is a thiazide-like diuretic. That means it is a low ceiling diuretic, so it can produce some volume depletion. This volume depletion may further increase the hypotension. So if any patient already having a volume depletion or any hypotensive conditions, chlorthalidone should be carefully given. And another important precaution is the decrease in the electrolyte levels. Chlorthalidone can produce few of the electrolyte imbalances, such as it can produce hypokalemia, hypochloremia, hypomagnesemia, and hyponatremia. Already we have discussed all these. And here hyponatremia is one of the condition which may produce the hypotension as the side effect. And hypokalemia may result in few of the symptoms like muscle weakness, fatigue, and even cardiac abnormalities like the arrhythmias can be precipitated. And this drug can also impair the renal function such that it can produce the acute renal failure. And particularly this can be more pronounced in the patients who are having the heart failure or chronic kidney disease. In such conditions, this drug may increase the acute renal failure. And finally, chlorthalidone can also produce few of the metabolic changes. It can increase the uric acid levels, and it can increase the cholesterol levels, triglyceride levels, and even it can increase the calcium levels. All this should be carefully monitored, and it can also impair the glucose tolerance. How it is given? Chlorthalidone is given as a tablet, and it is available at the different strengths like 15 mg, 25 mg, and 50 mg. So this drug is used for two conditions. First one, it can be used for the treatment of hypertension. Particularly, it can be given alone or in combination with the other antihypertensive agents. For the hypertension, the dose initially starts at 15 mg, which may be elevated up to the 25 mg. Similarly, for edema, the dose may be variable from 50 mg to 100 mg per day. So that's about this chlorthalidone. Chlorthalidone is a thiazide-like diuretic, which is chemically different but pharmacologically is similar to the thiazide diuretics. This drug is going to inhibit the sodium chloride exchange pump at the distal tubule. Therefore, it inhibits the reabsorption of so many types of electrolytes like the sodium, potassium, magnesium, chloride and protons. It cannot affect the calcium levels because the calcium reabsorption is going to be controlled by parathyroid hormone. And this drug is particularly indicated for treatment of hypertension and edema. And when this drug is going to be prescribed, if you have the precautions like hypotension, electrolytic and metabolic changes should be closely monitored. And it can also precipitate the acute renal failure if you have the susceptible patients. So that's about this chlorthalidone. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.